Joining us is Harrison and his mother. Welcome. So Alix, could you please just explain to me how you would treat Harrison, please?
Well, I've been treating Harrison now for a couple of years, and what I would do in a first session and what I would do in any session is I would assess the rhythm as it moves through his body. And normally in response to the head going through gentle widening and narrowing from the cerebrospinal fluid changing in volume, the whole body gently moves. And so I would assess his hips and just feel if they're moving well or what area's stuck. I would assess his ribs, I would assess his shoulders, and particularly his cranium, and try to feel for the gentle urging of elasticity in his membrane system. Harrison has had a particularly difficult time with his cranial mobility because he had an abnormal fusing of one of the cranial sutures or joints at birth. And so at a year of age, he had surgery to open up the suture and keep it apart. So as his brain grew, there was space inside his head. And as a result of the surgery, his development went back to that of a newborn. Right. And so he's really had to go through all the developmental stages all over again. Now, it just so happens that this area of the surgery is right over the part of the brain that controls all the muscles of the body. It's called the motor cortex. And so what Harrison's had to go through is had to learn how to walk. And just like all children, he's just been a year or so behind in development. And so my goal of treatment is to not only mobilize the tissues through his whole body, but it's to free up this membrane system so it becomes properly elastic. So as the fluid around the brain increases in pressure a slight bit, everything will expand. And this membrane system is like a balloon that surrounds the brain and spinal cord. And there's also a division that divides the left and right hemispheres and the upper and lower parts of the brain. And everything needs to be elastic and free in order to move. So what I'm doing now is in a sense as if I'm trying to lift his frontal bone to assess the mobility in his sutures, and they're free now because we've been working together for a while. And then it's as if I'm using the bones as handles to now work the cranial membrane system. And as I stretch, I can only stretch it with the weight of a nickel. It's the lightest pressure possible. And then I have to wait for his self-correcting or self-healing mechanism to make the change and cause that release to occur. But when that release occurs, it's permanent. So that little piece of membrane that might have been thickened or fibrous or less elastic has become normalized again, and we go on to the next restriction. And slowly over time, his system gets more mobile. Now, another thing that happens a lot with children that we treat is that they come in with chronic ear infections, and these temporal bones that the ears sit in need to rock backwards and forwards. I'm talking microns of movement. It's very subtle in order for the eustachian tubes to stay clear. And when Harrison came in, he had had a lot of ear infections. And so what I would do is by working the temporal bones just ever so gently, encouraging their normal movement, and then his system maintains that movement, the ear infection problem goes away. Children who are developmentally delayed or learning disabled, it's the same kind of situation often, is that there's a part of the membrane system that's just putting abnormal pressures on the brain. And so we really treat what we find. It's not that we treat the symptoms, we just treat the areas that are restricted and ask for them to release with our gentle forces. Now we do treat through the whole body too, and Harrison had a little bit of a scoliosis problem also, and that is an abnormal curvature in the spine. So what I would do is feel for the areas that are restricted, and his low back or sacrum is part of it. And I would very gently allow these tissues to follow into the place where they're most restricted. And if he needs to move a little bit, that's okay. And what I would do, instead of taking something that's tight and stretching it, which engages the body's defense mechanism, and then it's a bit of a struggle between patient and therapist, with this work, if something's tight, we go into it. And I support the body for the tissues in that restricted position for him, so his body can release.
It's okay.
Therefore, it's very, very gentle. Oh, I know you're tired, Harrison. You're doing great. And then I would take his cranium and his sacrum, hence craniosacral therapy, and I would gently rock them back and forth, looking for freedom in the dural membranes that surround the spinal cord. And that has been the key for allowing his scoliosis to normalize, is getting those tight areas out of the membrane system around the spinal cord. And sometimes with children, we might treat their system by unwinding and allowing the whole body to move into a position that's restricted in order to allow a release to occur in a certain place. Or we would just be very specific and work on the head itself. And
It's fine. It's okay.
I really think they don't really feel the pressure at all. They just feel little bits of internal pressure sometimes relieving as the system gets treated. Yes, you say it. Yes.
Helps when mom's right beside him, I think.
Absolutely,
Yeah.
and it's very helpful having the mother or father present to, sometimes we have, if the kids are really restless, they can even be read to, or we have story tapes or things that we could entertain them while they're on the table. Because it does take a little patience on their part. But generally they really like being treated because I think there's a part of them that knows that this treatment is good for them and that it's not going to be hurtful. So, in essence, any child that comes in with whatever restriction or whatever symptom, we would just assess the areas that are restricted and treat them and allow them to be free.
That doesn't taste very good.
Thank you very much, Alex, and thank you, Harrison.
And thank you, Harrison,
for
and
volunteering.
Allison for coming.
It's wonderful. Stay tuned for the Cranial Therapy Center telephone number and suggested readings.
Craniosacral therapy is a gentle, non-invasive, manipulative technique used to balance the craniosacral system, the environment in which the brain and spinal cord function. This manual therapy encourages the body's natural healing mechanisms to improve the operation of the central nervous system, to reduce stress and pain, to improve vitality, to increase the immune system's ability to prevent disease and treat sensory, motor, and neurological conditions such as eye problems, scoliosis, motor coordination, and learning disabilities. Suggested reading, Your Inner Physician and You, by John E. Upleger, available at health food or alternative bookstores. For further